Channel 3 is your vaccine authority, and we continue to see disparities in who is getting the vaccine in Connecticut, even as our state is touted as having one of the fastest rollouts. Black and Hispanic residents especially are getting vaccinated at lower rates. Channel 3 Eyewitness News reporter Mike Savino is live in East Hartford to break these numbers down. And Mike, how wide is this gap?
Well, Aaron, according to these new numbers that came out today, nearly 60% of people who've gotten at least their first shot are white. Meanwhile, blacks and Hispanics make up combined just under 9% of that group of people. And talking to these health experts today, they say that those trends will continue unless we have some specific strategies to address them.
The going in strategy should have over-delivered into these communities. So now we're kind of playing catch up.
Connecticut's vaccine rollout continues to roll on, but some people remain left behind. New numbers from the Department of Public Health Friday show vaccinations among black and Hispanic people remain much lower than other races. Only 6.9% of blacks received the first vaccine shot, 6.8% of Hispanics. That's compared with 16% of whites and almost 19% of all people. Health officials say there are a number of problems with the rollout, including outreach.
We're going to be going out actually and putting those in bodegas, botanicals, putting them in barbershops.
Bristol Health is working to educate Spanish-speaking residents. Other providers have tried to work with black churches. Then there's the issue of access. Providers are now adding new locations and using mobile clinics to penetrate cities.
It's a little bit of a logistical challenge to understand, how do we get them into different, how do we travel with the vaccine? But we do reassess continuously.
Wilson Camello is working with providers on outreach, but he questions why some of these strategies weren't used from the beginning.
There's a lot of efforts being made now to go into these communities, mobile clinics, etc. I would question why wasn't that at the start?
Hartford, New Britain, Waterbury, and Bridgeport have some of the lowest vaccination rates by town in the state. But Camello points out Hispanic and black populations do skew younger. With the new age-based rollout, effective strategies can pay off.
There's no question that as we go younger in the rollout of the vaccine, that we're going to see the numbers of people of color continue to trickle up.
In these numbers that were released today, the Department of Public Health relied on 2019 population estimates, whereas the first batch of numbers, they used 2010 census data. Camello says that's a good thing that they changed to the 2019 numbers because our state's population continues to become more diverse. Live from East Hartford, Mike Savino, Channel 3 Eyewitness News.